All right. Why don't we get started, everyone? First of all, I just wanted to say welcome to this is our session, our fourth session of our emerging technology trends to improve healthcare. This is our virtual learning series. If you have missed any of our previous sessions, they are all recorded. But today we are going to be talking about health information exchange to improve tribal healthcare. And we have with us today Steve Rotman, who is the Chief Operating Officer over at Wishin. And just to review objectives very quickly. First of all, we just want to provide an understanding of what health information exchange is here in Wisconsin. Next, describe how Wishin benefits patients, and then identify Wishin participation across the state, and review, if we have a chance, some patient summary data from across contributors and what this actually looks like in real time. And with that, Steve, I'm going to hand it over to you.
Thanks, Lori. And thank you, Mona, and everybody else on the MetaStar team for allowing us to take some of your time and orient your participant users to Wishin and the value that we can provide to the tribes across the state of Wisconsin. Next slide, please. We will again provide an overview of Wishin. We'll discuss why Wishin is important and how it can play a role in your data acquisition, your improving or supporting your ability to make clinical decisions and manage patients as they seek care in your facilities. We'll talk through who's in the network and address any questions and answers. I would also encourage that if there are any questions that you can raise your hand or just chime in and we'll address those in real time. Next. So an overview of Wishin. We are an independent not-for-profit organization founded by the Wisconsin Hospital Association, Medical Society, WIO, which is an all claims payer database, and WCHQ, which provides healthcare quality and supports healthcare quality initiatives in the state of Wisconsin. They came together under the Obama administration when there were high-tech funds available to each state to create a health information exchange. Some chose a regional option, some chose to run the HIEs out of state government. And in Wisconsin, they designated an independent not-for-profit organization, Wishin, to be that health information exchange. And as the last point shows, that we have a state designation as the entity for health information exchange. Our goal is ubiquitous, vendor-neutral, electronic health information exchange. So what does that mean? What's the plain language on that? Ubiquity, our goal is to be represented and available across the state of Wisconsin to any and all healthcare providers, payers, correctional facilities, tribes, pharmacists, etc., regardless of the EHR or absence of an EHR. So we work with the major EHRs out there like Epic and Cerner, and work with organizations that are on paper and use our system to, again, support clinical decision-making and manage the care coordination of patients. As I mentioned, we're working with a number of types of organizations and not limiting the data that's available to them in a way that is time-bound or historical. The purpose is to provide that historical context and view in a longitudinal way. Next slide. So why Wishin? And I mentioned this previously. specific to this audience, improving outcomes and patient care. That's not new or novel to this audience, I'm sure, nor is it across the state of Wisconsin. But the goal is to provide the right information about the right people at the right time. And we aggregate clinical information in real time from hospitals, clinics, FQHCs, community health centers, post-acute, as I mentioned, corrections. And again, it's regardless of what EHR you're using, aggregating that in a way that you can see some person's information, regardless of where they've received care, whether that's in UW Health, SSM facilities, Advocate Aurora facilities, Bellin facilities. Those are just a couple examples. And you can view that information without having provider-centric chunks of information coming at you or requesting that data. The data is sent to us prospectively, reducing that burden of requesting that, again, that data. You don't have to make a call. You don't have to wait for a fax to show up or a direct secure message to come in or manage multiple points of entry into a variety of EHRs. We receive that information, again, ahead of what would be a visit that you would have access to. We're also supporting some population health efforts, which will continue to grow. We recently hired a director of population health and analytics. His name is Matt Jago. He is working on evaluating our data to see how it can be used in new, unique, and novel ways that support population health efforts. If that's managing a diabetic cohort, managing hypertension, population of patients, or high utilizers of the healthcare delivery system that you, as an organization or a tribe, are trying to manage or coordinate that care so those individuals receive the best care. And there's also workflow integrations via a single sign-on with those EHRs that can support that type of functionality. Additionally, we'll talk about it later as well. We have a direct connection into the Wisconsin Immunization Registry. So while you're looking at a patient's historical records across the state of Wisconsin, that you can view the Wisconsin Immunization Registry. And I will say that while we are statewide, we also have some representation and information coming from the Upper Peninsula and Northern Illinois. We are not in every facility in the state, and nor does every facility in the state send us all the information. So we do have a list of what information is available from whom, and happy to share that. But the likelihood of you finding some information that could support, again, coordination care, decision-making, it's pretty likely. In regard to HIPAA compliance, privacy and security, HIPAA stands for Health Insurance Portability and Accountability Act. And this was brought to us in 1996. There's been evolutions of HIPAA to consider use and use of EHRs and EMRs and moving that data electronically. And how we've been able to address that here at Wishen is by way of our data sharing participation agreement. That agreement takes into considerations the provisions, the obligations, the HIPAA privacy rule and HIPAA security rule, so that a patient's information is protected at all times, is used and disclosed to the right people that have a relationship with these individuals. But also, if there's somebody new to an organization, that there's an opportunity to break the glass and log that information. So a provider is not limited to accessing the information that it should have access to, but also that every click, every query, every patient search is logged in our system for use and disclosure purposes. In Wisconsin, patient consent is not required. So, but we do honor patient choice. So if an individual wants their information not to be shared by way of wishing, we have a mechanism to do that, which is a global opt-out, keeping in mind that we do not manage the consent for provider use or disclosure or their vendor specific exchanges like Care Quality Commonwealth. Our patient consent and choice is managed through the Wishin network only. And as it relates to information blocking rules, really, we exist to avoid any opportunity for information blocking, making sure that information flows seamlessly across the care continuum. And finally, on this slide, transitional care management, which is a Medicaid revenue opportunity potentially, or it's just a way to manage your patients outside of your four walls, is we can provide a daily report, which we call the PAR, or patient activity report, where an organization can send us a roster of patients that it wants to track. And daily, Wishin will send a report back in a secure fashion, those patients from that list that had an ED or an inpatient encounter. That allows organizations to react in a way that they might not otherwise be able to if there's a diabetic patient that showed up at a hospital with a diabetic event, and you otherwise would not hear that until maybe a claim came through, or that patient or family member informed you of what happened with that patient. So you're able to manage that individual's care and reach out to those that are maybe new to that individual's care team to help make sure that that individual is managing their diabetes or their hypertension or whatever else might be the situation. Next slide. I've reviewed a bit of this already, so I'll breeze through Wishin Pulse. So the system I have been speaking about is Wishin Pulse. It's our flagship product. Real-time data exchange, aggregating it, the information, presenting it in a longitudinal way, and it's not segregated. So any and all of that information that we have about a patient, we're presenting in a way that's easy to consume. It's very intuitive, and it's built in a way that you can find allergies, find medications, find documents again, it's very easy, very consumable way. And it's the data within our system is also ingestible into a foreign system. So whatever your system may be, you can download or extract that information and merge it with your health data. So what information is available? So ADT, or admit, discharge, transfer information. That's patient demographics, problem lists, chief complaints, diagnoses, allergies, etc. That information is made available. We have over 1.5 billion ADT messages in our system today. We also have laboratory pathology micro results. So where organizations are sending us those lab results, we can present those. No need to call on those organizations and wait for those results to be sent to you. Care summaries, electronic care summaries, or continuity of care documents, they're in the form of a consolidated clinical document architecture, CCDA. Those include some discharge instruction, again, patient information, where that visit occurred. So these are sent to us at the close of a visit or discharge. At this time, I think we have over 48 million CCDAs in our network. They also have a medication reconciliation list within. When a radiology report is signed, we are receiving those from many organizations. Transcribed reports. These transcribed reports are not being sent by everybody, but that is going to change here by the end of the year, where we're receiving more and more history and physical, provider notes, surgical notes, discharge summaries, advanced care planning documents, or advanced directives. And then in red there, I mentioned it previously, we have a connection to the Wisconsin Immunization Registry. We have a connection into the Enhanced Prescription Drug Monitoring Program, EPDMP. This is where you can look for the controlled substance prescriptions. We have prescription fill history that we're receiving twice daily from Medicaid. And we have a few health plans that are sending us weekly batches from their PBM system of medication fill history. So that fill history, in addition to the medication lists and other information, can provide visibility into med adherence, med compliance, and how that individual is with, I'll say diabetes again, is managing that diagnosis through their medications or not. The last three are care plans. Those are sent by every MCO for their HMO populations. In-home reports, those are sent to us today by one in-home provider, Optum. So we do have Optum in-home reports, and also pre-hospital reports being sent by the City of Milwaukee Fire Department, EMS. So every EMS run they do, we receive pre-hospital reports. I know, again, the audience here, City of Milwaukee reports might not be all that relevant, but our goal is to expand this throughout the state of Wisconsin, where there is EMS transports, either planned transitions or unplanned transitions due to a trauma or emergency, that information would be made available to track outcomes and delivery of where those patients received care. Next slide. So here's a quick snapshot of who's in the network and pins on our website. There's a link here that this slide deck will be made available, but this is not an exhaustive list either of who's participating in the network. For this audience, we are working and contracted in various ways with Ho-Chunk, Menominee Tribal Clinic, and Oneida Nation. Again, if there's any questions about who's in and who's providing, that link will be able to show who those individuals are. Next slide. Quick dashboard here of the breadth and depth of data that we have in our network. Over 2,100 sites of care. We have, again, I mentioned 1.5 billion ADT transactions from the more than 120 hospitals and 2,000 sites of care, otherwise like ambulatory, pharmacy, FQHCs, et cetera. So I won't spend a whole lot of time on here, but I want to call out the care summaries. Again, 48 million care summaries, and that's going to only increase as organizations send us more data. Next slide. A list of our health plan MCO participants. We have every MCO in the state participating. Managed care organizations are really our highest users of the system today, managing the care and using Wishin as a demographic update tool. In addition to a source of truth when it comes to supplemental data for their HEDIS reporting. And that's indicated by the two asterisks with DAV health plan. So that's how they're using us. But where your organizations have relationships with health plans, Wishin can be a mediator, a source of truth, again, between your organization and a health plan, really accessing the data that they're sending and them having access to the data that you're contributing to. You could be contributing to the network, relieving your staff from having to respond to the requests from health plans, directing them to go to Wishin if they're looking for information. Next slide. Okay, we're at the Q&A, and Lori, if you want, I can go into a quick demonstration, or we can just walk through the slides at the as an appendix to this slide deck. What would you prefer?
You know, it's really up to you, Steve, but I did just want to pause just for a moment just to see if there were any questions that anyone had. And also just one question of my own, and maybe that comes up many times as I've talked to different organizations and different people about Wishin, and maybe this is part of the demo as well, where we'll see. But can you just sort of describe the difference between what you can receive on Wishin versus, let's say, Care Everywhere through Epic? Or I know a lot of the clinics that I work with, such as tribal clinics, also sort of have a sign in, you know, so to speak, into Epic. And so can you just sort of describe the difference?
Yeah, so I'm not an expert at Epic or Cerner. What they provide, our understanding is that those that have an Epic Care Link direct login, that meets their need. And where we're not in, we don't exist to compete with Epic. We exist to complement what those Epic systems can provide, but also where those Epic organizations are contributing data to us could limit the number of logins that an organization has into various Epic systems. So you could see ProHealth, SSM, Advocate Aurora, Bellin data in a single pane of glass being Wishin, rather than having to log into each of those systems individually and then put those pieces together. And Epic, not everybody uses Epic, not everybody uses Cerner. So those organizations that are using Athena Health or eClinicalWorks, or again, some other system that doesn't have or can provide remote access like a CareLink, we are a mechanism to aggregate that data and present it in a way that's easy to consume. Mm-hmm. Does that help?
That does. Thanks so much.
You bet. Well, I can jump into our demo environment. I'll just shortcut the patient login if that's all right. And
sure. Should I stop sharing and allow you to share then?
Sure, I can do that.
Okay.
And how much time?
Oh, I'd say you probably have 10 or 15 minutes.
Okay.
Mhm.
Okay.
And let's see, Steve, going to, okay, there we are.
You can see that okay?
Yes, thank you.
Okay, great. Let me just slide this over here. All right, so what I've done is I've logged into the system as every user has a unique login credentials, a username and password. And then I searched for Tony Stark. So you only need to know the patient's first and last name. And then if you have a treatment relationship, that information will come up. If you don't, you can break the glass. And as I mentioned previously, in accordance with HIPAA treatment and payment operations, that's acceptable. And that's also logged for use and disclosure purposes. So that's what I've done. I've logged in, I've searched for Tony Stark, and now I see Tony Stark's longitudinal record here that is showing multiple encounters from various sites of care. Avengers Mercy Hospital, Avengers Family Care in Menominee Falls, Marvel Regional Hospital. Obviously, Tony Stark is a fictional character, and but for this purpose, we see that here's his the latest demographics that Wishin has from the latest encounter. The age, date of birth of Tony Stark. We have some alerts here. Any advance directive on file, severe allergies that are available in the network, abnormal labs. So let me back up to severe allergies. Severe allergies is a subset of all allergies. Abnormal labs. Abnormal lab flags are coming from the sources. Wishin is not determining what those abnormal flags are, but that's a subset of lab results and radiology reports. As I mentioned, we have single access into the ePDMP. I can launch that to demonstrate. So this is going out to the ePDMP using my credentials, which I don't have credentials to the ePDMP, and Tony Stark doesn't exist. So that's an expected error that Tony Stark doesn't exist. But then we can do the same with immunization. So without having to log into those systems separately, you can access this information. And again, it's in the context. Here's the vaccine schedule and immunization history in the context of the longitudinal record. So let's say we wanted to look at this emergency face sheet from Marvel Regional Hospital. We click on this. So instead of calling that hospital and requesting the latest information or a face sheet and waiting for that to come via fax, we're presenting it within seconds. The patient details, visit information, any emergency contact or guarantor, insurance information, those that were on the care team as part of this visit, any allergies reported, diagnoses, procedures, vitals if taken, lab path, and then any documents or reports. So this would be a discharge summary or ED note that would be available. Then we can go back to view if we're interested in the medications Tony Stark is using. We have this information. So what we're doing, those CCDAs I talked about previously in medication lists, we're taking those medication lists and pulling that data out so it's available discreetly. And you can look at dosage, quantities, etc. for the specific medication or prescription. We don't yet have in this demo environment payer prescription information. So fill history, we're still building this demo environment to include that, but this is where it would be. So now you're seeing what's reported in a reconciliation list and now what's reported from the payer. diagnoses, procedures. In both, you'll see either the SNOMED, LOINC, CPT, ICD-10 codes. This is where this all exists. Lab results, pathology results, micros, radiology reports. So we can look at this glucose bedside lab result. Again, not having to call that lab, waiting for that information to be sent. With labs, Wishin can function as a lab delivery system. So where you might use a reference lab, those results might be difficult to get back into your system. We can be a mechanism to accomplish that. And here you'll see the result of this lab. And for a radiology report, we can look at this chest X-ray that Tony Stark had. So that, again, the information is sent to us prospectively that you can use for your care decision-making purposes. Documents, this is where plan of care, ED notes, provider notes. I see something in chat. Come on. Oh, sorry, that was you.
Yes, Steve, it was just me. I put the link to the survey just as a reminder.
Cool. So plan of care. This may be short, it may be extensive, but whatever that organization is sending us, again, it's a single pane of glass. It's a source of truth for the information that you have. Now, if you see there's records available, we limit it to 10, so it's not so overwhelming. There's 10 of 31. You can expand this list and sort it by any of these columns. You can sort by date, time. You can search for notes, and then anything specific to a note would be here. Let's look at this operative note. Here's a full-on operative note that now you have access to. The last few things I have to show are CCDAs or CCDs, continuity care documents. A lot of various names for these, but a CCD is a CCD is a CCD in Wish and Pulse. They all look the same. They all have the same template. But the information, again, is sourced by those providers at the close of a visit or discharge from emergency department, urgent care, etc., inpatient stay. So we have the various sections here, and I won't go through this entire thing, but it's all the information that you would want about Tony Stark. eHealth Exchange. So we do have connections to the eHealth Exchange, to the Veterans Administration, to DaVita, and to Unity Point Meritor. So those organizations aren't directly sending us data as many of our other sources are. So this is a way that you can access DaVita data, VA data, and Unity Point Meritor. Okay. Two more things I want to share with you. This heart. This is a way that you can favorite patients, and then they show up on a My Patients list. So now maybe this is a diabetic cohort that I'm managing as a care manager, or individuals that are important to me that I want to track. I can see latest inpatient, latest ED encounter, but also if I just usually want to see what's going on with these patients, maybe they're frequent utilizers, I can jump right into Tony Stark. I don't have to query for him in his longitudinal record. And then the last, actually, sorry, there's two more things. This timeline view, watching where folks go from a utilization perspective. we were presenting emergency encounters, outpatient encounters, inpatient encounters. Soon we will be adding SDOH data to the community health record, where there will be an alert here for SDOH needs and also SDOH encounters on this timeline view. I don't have a timeline for that. It's phase 2. So sometime in 24. The incorporation of analytics and dashboarding and trending. So here we're seeing a trend of glucose bedside, hemoglobin A1C, etc. For hypertension or those that are managing their blood pressures, we can see a trend over time. We can see A1C, we can see LDL panels. And then the last thing I did want to share is the use of a super CCD. So what we're doing here is we're aggregating all of this information, the visit history, allergies, medications, diagnoses, procedures, lab, into a consolidated document that is cross-network and taking in information that otherwise would not be on a CCD. And you have the ability to create a human readable CCD that is network wide for a patient. It looks just like the CCD I showed previously, wherever that document went. But an aggregation of all that patient's information in one location. So Lori, open to any questions, but that's about what we have to share today.
Well, thanks so much, Steve. Did anyone have any questions?
Hi, good afternoon. This is Natalie at St. Croix.
Hey, Natalie.
Hi, Natalie.
Thanks for joining us.
Yeah, thank you. This is exciting. I'm like totally into interoperability and sharing information. I guess my question, we're kind of on the we're pretty close to Minnesota. Do you have any facilities in Minnesota that participate in this as well, or is it just strictly Wisconsin?
It's not strictly Wisconsin.
Oh, you said that, yeah.
Yeah, Minnesota law, patient consent law is different though.
Yeah.
Where informed consent is required. We're having a conversation right now with Gunderson. Gunderson is onboarding. Who else? HSHS is onboarding. We're in conversation with Mayo. Haven't had a whole lot of conversation with Health Partners or Alina, but we're familiar with their existence. And anybody in that kind of your orbit, those Wisconsin-based, like I said, Gunderson, I didn't mention Marshfield. Marshfield is in as well. And so, yeah, we could get that Minnesota data in, but Minnesota hospitals, ambulatory tribes, they would have to get informed patient consent before that data could be sent to us, just as a consequence of those laws.
Okay, thank you.
Mm-hmm.
And then I guess one more question is, so is this like you mentioned you don't actually need to even have an EHR to be able to join this network. Is it like a single sign-on then? Like you just have like you go to a site and then you sign on from there?
Yeah, so it would really be a login, a secure login to this portal. So it's a web-based portal. So you wouldn't have to have a single sign-on, but we can accommodate a single sign-on connection to an EHR. If you don't have one, then the web-based portal is how you would access the data.
Oh, gotcha. And then so if you do have an EHR, is it like if you're sharing information now, how are you, is it like attached to your EHR somehow?
It is.
Okay.
It is. Like for Epic organizations, it's within the Care Everywhere section of the EHR record.
Okay. And then so this is, did you say Wisconsin? Well, Wisconsin's no consent. So it would just automatically, so if you agree to participate in the network, then automatically your patient's information is going to be uploaded unless they sign and opt out.
Correct. Yeah. And we strongly recommend that organizations update their notice of privacy practices so patients understand that Wishin exists and that their data will be sent to this network as part of that health system or hospital. But that's correct. That data would flow seamlessly from the EHR to us.
Okay, great. Thank you.
Thank you.
Did anyone else on the call have any questions or comments? Carla, I know you're from IHS and you're joining us just here at the end, but did you have any updates from IHS as it relates to health information exchange that you wanted to comment on?
Good morning. Hi, I just jumped on, so I'm just coming at the tail end and I apologize for that. I'm trying to go between two meetings, so I'm not really sure what was discussed, so nothing today. Thank you, sorry.
That's fine, Carla. We'll catch up with you. No worries. Thanks for joining us today. Steve, are there any other sort of frequently asked questions or concerns that people have that you kind of want to talk about in these last couple minutes before we part?
Natalie asked a lot of good questions. Patient consent is one, how that data comes in. I think we've addressed most things. The data again is ingestible. So if the vendor that they're using can ingest data, we can provide the CCD in an XML format. And I'll add also that with CCDA capability, if there's a known visit happening, we can work to automate the query of data from Wishin. So say there's 15 visits scheduled for tomorrow. An organization can set up an automated query to ask Wishin, do you have these patients? If yes, please send me all the documents or the CCD or combined or super CCD back in, and the organization can hold that information in like an inbox or ingest that data into those patients' records so that instead of having to log into Wishin, maybe that's enough information to support that they otherwise would not have. So, but other questions, not that I can think of.
Very good.
Happy to address any questions on another call or individually if folks, my information is in the in the slide deck.
Yes, and just for everyone's knowledge, I put two things in the chat. First of all, I did put a link to the slides from today's presentation that do include Steve and Wishin's contact information. You can get all of the hyperlinks through that. We are very interested in feedback on today's event as well. So I also put that the link to that survey. So if you can take just a moment after this meeting to go ahead and complete that, it would be very, very appreciated. This meeting is recorded, and so for those of you who either joined late or know of colleagues that weren't able to join today, this will be available and we'll be sending that out following this, this event as well. So thank you so much, Steve, for joining us here today to tell us a little bit about Wishin and health information here in Wisconsin. With that, I want to say thank you to everyone who's participated in this learning event.